So in terms of the topics that the webinar will cover, this is going to be a quick recap of the key provisions of the Care Act 2014. That's going to be something I go through quite quickly. I'm going to look at the service provision challenges. That's obviously the key focus for this webinar. And in particular, looking at the resource issues that are part of the underlying landscape within adult social care and health provision. Specifically, then, I'm going to look at hospital discharge because of recent statutory changes in relation to who is responsible for meeting a person's needs and getting them discharged from hospital. And because it relates to that, I'm also going to look at the question of continuing healthcare. So whether that's the responsibility of the NHS or the local authority to assess and how disagreements can be resolved. A current challenge for all sectors is the use of technology and the extent to which artificial intelligence is allowed to take over functions of humans. So I'm going to look at that specifically within the adult social care / health context. And the last topic for this webinar is liberty protection safeguards. Liberty protection safeguards obviously being the statutory scheme that was intended to replace deprivation of liberty safeguards from Schedule A1 of the Mental Capacity Act 2005. We then come on to the division between needs and wishes, because again, this is relevant to resources. And it's important to recall that this is a statutory scheme which is about meeting needs. It's about meeting eligible needs. It's about doing so in a way that tries to meet needs in a way that is acceptable to and agreeable by the service user. But ultimately, there is going to be a line that's drawn between what a person needs and what they want. And that's very much a question for assessment.